Today we're going to talk about Emphysema Part II. And the last point we mentioned on Emphysema Part 1 was a breakdown of septa which happens in people who have emphysema. But in Part 2 we're going to delve a bit deeper into the types of emphysema and its symptoms and treatments. So the first type of emphysema is central acinar emphysema. Emphysema usually happens in the ending of the lungs, the acinar of the lungs. And central acinar emphysema happens in the middle of it. This is thought to happen because the irritants only move so far into the lungs. That is the middle of it. And this usually happens in the upper lobe of the lungs. Next is pan-acinar emphysema. This happens due to a alpha-1 antitrypsin deficiency. In a usual day of the lung, the immune system is flushing out proteases which clears the debris. But if the immune system overreacts to it, then it can damage tissue. And to counteract this, there is a protein called alpha-1 antitrypsin which controls the immune system. But to some people, there is no alpha-1 antitrypsin, so the emphysema gets distributed evenly in the acinar. And this usually happens in lower lobe of the lungs. Next is paraseptal emphysema. Paraseptal emphysema happens in the surface of the lungs, the peripheral surface of the lungs, and it happens in the very ending of the alveoli. And mind you, this inflated alveoli in the end can rupture, which can lead to a pneumothorax. And there are more symptoms relating to emphysema, like a barrel-shaped chest and increased interior to posterior this diameter and a flattened diaphragm. And another symptom that you might already guess is dyspnea, which is the scientific word for shortness of breath. And to counteract the collapsing of the alveoli, people who have emphysema exhale slowly through pursed lips, which gives them the nickname pink puffers. Because pink means they can oxygenate the blood, but they have to do it in a certain manner to do it without collapsing the alveoli. And there is another method which works great if hypoxia is localized, and this is called hypoxic vasoconstriction. Yes. And if you have two alveoli here, then if this one constricts, then it gives more work to the other one, and this works great if the hypoxia is localized. But in people who have emphysema, more of the tracts get collapsed, so this means hypertension for the right side of the heart, pulmonary hypertension. So because of this, the right side of the heart gets enlarged, and this is the process called cor pulmonale. And there are some treatment which is, as you might already guessed, is deleting the factor which causes emphysema in the first place, which is smoking. Quit smoking. And then the next one is like you can take some medications like antibiotics which will reduce further bacterial infections in the lungs. And there are many more to aid emphysema. And we'll be talking more on space science and human science later on this channel. So stay tuned for the next episode. Thank you.